often described as stabbing or shock-like. Diagnosis is made based on symptoms. And then lastly, when you, we may talk about this a little bit in ortho when we talk about upper extremity, but when you get into neuro, you'll talk about this. Remember when I was talking about double crush syndrome earlier, how you can get muscles that are tight that limit the mobility of your peripheral nerves. If I stretch up, I'm bringing my nervous tissue with me. So as I stretch up and I get it in the right position, yeah, I'm feeling a little bit of vague tingly sensation in the tips of my fingers. I feel actually a little bit of a need to flex my fingers because I'm putting my median nerve on max tension right now. I really feel this in my median nerve. So if I wanted to treat the median nerve and symptoms associated with it, the median nerve needs to glide and slide in the body. So I might selectively put the median nerve on tension. And so you will definitely learn more about this later. You might even sign yourself up on some Con Ed for this later on to get even more. There's a lot of nuances to this. But remember, the nervous system is a continuous system that if it's immobile in one section, it can affect the entire system. We might be able to do these nerve glides, if you will. Some people will call it stretching. I don't like saying stretching for a nerve, but I'll use the word glide to improve the circulation of the nerve, improve the nerve's ability to glide and slide around the other structures that it needs to. All right. Questions?
I do. About the nerve gliding, in the outpatient place I was at, I remember sometimes PTs would want the patient to, I don't think, stretch isn't the right word, but the movement is moving the head to one side and then moving the arm in the opposite direction. Other times they want them to move it in the same direction to like floss it.
Yeah.
What the difference is?
Flossing is another good word for that as well. So if you can imagine putting tension, what actually want is kind of encouraging mobility by pulling it along. But since nerves aren't necessarily stretchy like a muscle is stretchy, sometimes we'll treat it by flossing and gliding it back and forth. So it kind of depends on the patient's presentation, their sensitivity level. If they have, if they're highly sensitive, then you might not want to put any tension on it. So pulling the head and the hand away is going to put more tension because where is the nerve going to ultimately? Your spinal cord, right? So you move the spinal cord, that'll affect, if I took my nervous system and just laid the brain, spinal cord, and all the peripheral nerves out on the table, right? Like my sweater. So here's my nervous system. And I'm going to set it right here. Okay, here's my brain up here, and here are my spine, my peripheral nerves, my arms. Okay, and if I move here, right, you see that part of my nervous system is moving. It's all connected. So sometimes we'll do even neural mobility on the opposite side if this side is too hot, painful to move. I'm going to try moving the other side and see if we can affect it that way, right? But that happens in your whole body. If I move my leg, I'm moving my nervous system, right? My nerves are gliding and sliding around all the structures of my body while they're trying to send information back and forth.
So is there, what's the difference, or why would you want to floss versus apply tension?
Again, the tension may be to actually encourage movement, right? Where the flossing may be to maybe not quite so much put tension across it, but to get it to just slide. Does that make sense? Okay. So tensioning will decrease the blood flow temporarily. And then when you untension it, your capillaries are gonna refill, so there's one mechanism. The tensioning can kind of pull it along, right? But it depends on the symptoms and how chronic the symptoms are and how irritable. So if they're highly irritable, probably gonna stick with something that doesn't put it on tension. But if it's chronic and it's not irritable, you might try putting some tension across it to see if that doesn't help it.
It could be more aggressive.
It'll be more aggressive, yeah. Okay. Everybody stand up and stretch. Okay, so we're going to do our Kahoot for neurological pathologies. As soon as I log into Kahoot. Yes. All right, join us when you can. All right, there's your pin. You guys see that okay?
Which animal has the largest eye?
Which animal has the largest eye? I don't know, a humpback whale?
No,
No?
it is aquatic.
It is aquatic. A squid, giant squid?
Yep, that's good.
Thank you for that. Now, the question is, how big is it?
I would speculate, I think it's something like the size of a foot.
Like dinner plate size?
About dinner plate size, not that big.
Bigger than a whale's eye?
Creepy.
Yeah, it's the biggest eye.
They have, so a giant squid would then, shouldn't that have also a giant squid beak?
Pretty heavy.
It sounds frightening, actually.
Giant squid, what? Cephalopod famously eats giant squids. Which whale does? Like,
Whales eat, yeah.
Which one? in
Oh,
particular?
which whale eats a giant squid?
Which famous?
Which?
famous whale?
Killer.
No, not killer
No,
whales.
no.
Sperm whale.
Sperm whales.
Sperm whale, huh?
That's all they have all those scars on them. Big blue whales, what's
Oh, we got good names going on here. This is good. Cry, eagles, cry. That's mean. Team Riri. Wait.
Rihanna.
Oh, I didn't watch it, but I heard like all of a sudden people on Facebook are like, that was the worst I've ever seen. I'm like, oh come on, give her a break. And then they're like saying, oh well maybe it was bad because she was pregnant and she couldn't move around.
I can't believe they let her go on them still.
All the way up.
Yeah, I'm
that's
like, girl.
crazy.
Oh, I didn't see. What did they do?
She went really high up in the air,
She was
like
on
on
a
a
Platform,
platform.
they like hoisted her
And
like
she's
all
like
the way up.
pregnant, so it's like.
She's
And then
strapped
at
in.
one point you can see the
She's strapped in.
platform going back
I
and
think
forth.
like, yeah, like her sweater was like
No.
locked to her or something.
Yeah,
Got
she
a
was
cord
harnessed in.
on her back.
Yeah.
Oh my god. All right. You're gonna get 100% on this. It's gonna be amazing.
35 minutes.
This is from Friday. Can you retain information over the weekend? Ah, the pia mater, that's the one that's right, and then the dura mater is the outermost. That's the top dura mater on the outside. Dura meaning durable. I don't know if that's what they meant by it. Sounds good though. Arachnoid matter. What does the arachnoid matter do? Or what's special about the arachnoid matter?
I think that's where like the CSF fluid is, circulates in that area.
Well, it's circulating between the arachnoid and the pia mater, I believe. You just made me forget. Into the ventricles, the vasculature, there's blood vessels, that's where your blood-brain barrier is existing. Excellent. Good job. Neuropathy is in the lead. Okay, temporal lobe. What is the occipital lobe in charge of? Say that again? Sight, yeah. I gave you a little hint with that picture.
Not paying attention.
I don't always give hints with the pictures, but it was the person writing and the bag over their head had a big unhappy face. Wanted to deprive you guys of the music. Excellent. Sensory goes up to the brain, motor comes down. Excellent. Most, we have to clarify that, it's most bacteria cannot get through the blood-brain barrier. Most, but not all. So go back and look that up, because my follow-up question was going to be, what disease process do we see when we are unable to produce enough dopamine in this substantia nigra? Parkinson's. Very good. I almost said, are you asking me or telling me? I was channeling Mr. Leong. Okay, vernix aphasia, or some people say Wernicke's aphasia, but it's vernix aphasia. You would not see with the cerebellar stroke, because the cerebellar is responsible for helping us control and coordinate movement. So ataxia is the inability to coordinate your walking. Nystagmus is inability to coordinate eye movement. And